Hello everyone, we are in the office practicing all of the safety rules to keep this place clean and neat and safe for everyone to come and leave healthy. So I'm going to take off my mask since I'm sure that you're far away from me now that you won't get anything from me. Okay, so let's talk about nerves, muscles, and movement. We are a body that's designed to move. Our movement is created by muscle movement that comes from our brain. People come to see us because they're having a problem where one side of the nerve is firing because it's pinched. It's pinched on one way, so they feel it's okay this way, but maybe I can't do that, or I can't do this. Or people come to visit a chiropractor, or me, because both nerves are firing, but they hurt. Or the injured area is not working as well. That's the motors. So there's three things a nerve does. It does reflex, it does sensory, and it does motor. Motor is the muscle. There are times when you will have a problem with something, but an area of your arm, your shoulder, but there's no pain, but it just doesn't work like it used to. So that only the motor part of the nerve is being compressed. If you have pain as well, that's the other story. And if you have a reflex issue, now you have the whole nerve being compressed. What our goal is to take a situation like this and correct it so that it fires properly on both sides instead of something like this, or having both sides fire like that. So based on what I'm just talking about, we're going to talk about how to get the structure to hold the adjustment. Now, there's two units I'm going to talk about today. This is a trigger point unit. This is a multi-head unit that is designed to get to those spots to relax the muscle groups. So we're going to start here on the lower back. Now, the first thing I want you to understand is that this patient is on SOT blocks. We're balancing out his hips. We have this one, this hip is lower, we're moving it up, and this hip is too high, we're bringing it down. So that we have the legs in a concerted order. The ankles are normal. Would you bring your head straight ahead, please, sir? Hands straight ahead, pretend you're praying. And we got the arms that are also equal. So we can see that this person is properly set up. Now, we're going to look at the cervical region because most people have an issue that starts in the cervical region and develops into the low back. We're going to talk about in other sequences, other videos that we show in the future. So, we're going to take this particular unit and we're going to start in the lower area. Now, how does this feel, sir?
Relaxing.
Okay, so we're doing trigger point work, but we're waking up the muscles. Remember, it is important that the body know that blood flow has to get there. Now, I want to talk about something that perhaps you've heard in the past. If you read some old books, it's called sensory motor amnesia. And that means sometimes when we have a stiff muscle, a stiff area, like our head is down all the time like this, and the area in this region right here gets very tight. The reason it got tight is it's trying to bring the head back, because gravity's got the head because it's going forward. So because those muscles don't get a chance to relax or go back into their normal, natural, relaxed state, the brain no longer talks to it. It's called sensory motor amnesia. There's no sensory there. So what we're doing right now is we're getting to the sensory. We're waking up this area so the brain reestablishes its communication and say, you've got to relax. At the same time, it's essential that we bring the head back over the shoulders so as not to hold all these muscles trying to keep the head upright. So what we're doing now is stimulating that area. At the same time, we're knocking down those high points, those spasms, those little spasms, microspasms that we have in our muscle groups. How's this feeling, sir?
Very good.
Okay, we always want to know how the patient is doing because remember, they got to feel good while they're getting better.